Okay, so a nurse asked me a wonderful question. I really love this question. The nurse wanted to know if they gave a unit of blood to a patient and the patient was O negative and the unit of blood was O positive, would that change the patient's blood type? The short answer is no. One unit will not do that. However, the person could form what's called an antibody, and it would be an anti D, which D is associated with the positive nature of the O blood, the O pos blood. Further, if you gave a person 10 to 12 units of red blood cells, you could temporarily change their blood type. And by that, I mean when we get a new sample on that patient to process, and if we do a blood type on them, it could show the blood that we just gave them. And that's because the blood has not gone out of the patient's system. So, in essence, what you end up testing is just what you just put in them. And I've seen this happen lots of times, especially like over the years. Once we had a trauma patient who was like bleeding profusely, like blood spewing. And, the blood that was going in was simply what we were giving him. Everything was just going onto the floor. So when we got our next sample on him, it was not his blood type. It was O pos. And so that, of course, was not correct because he was A pos. So, yeah, you can change a blood type. There's other times where you can change a blood type. If you have a bone marrow transplant, so you get a bone marrow transplant, which makes your cells and everything like that, you're going to all of a sudden see a person go to whatever type that person who transfused to them. So the recipient's going to become that blood type. So, and that's it could be a permanent change then because you're looking at the cells from the bone marrow of someone else. That's a whole different conversation about making sure things are compatible, blah, 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 blah. But I really like to see when nurses want to learn about things like that, things that they do, they give to patients on a regular basis. You give blood all the time and you don't know the effects of what you're giving. So it's always good to ask. Most people, most laboratorians are willing to tell you, we might not like people. Okay, I like people. But we love educating, most of us. All right? That was a very good question. All right, have a great day. Bye.